Bob and Brad, the two most famous physical therapists on the internet.
Howdy, folks. I'm Bob Schrupp, physical therapist. Brad, stick with me here.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
Well, Bob, in our opinion, of course.
Today, we're going to explain the shoulder, and we're doing it by really bad drawings.
Yeah, but Bob, it's your shoulder. I was wondering why you're messing up your clothing.
Up.
Yeah.
Yep. So we're going to explain to you what we feel when we palpate along on a patient. I suppose they don't know what palpate is.
Yeah, so when a therapist or doctor is pushing into your arm and your shoulder with their fingers, they're feeling for certain landmarks, tissues, things that are either abnormal or normal, and where there's painful areas.
And what is this here for, Brad?
Well, Bob, once again, we have a wonderful giveaway of these beautiful SleepOvation mattresses. 700 tiny mattresses. I counted all of them. And there's springs behind there, airflow. They are extremely comfortable. And
they're really made for if you have pain. I mean, they're always comfortable,
right?
No matter what. But if you have pain, this is really good.
They support my back like no other mattress, and I can sincerely say that I'm grateful.
And that's just a small sample, by the way. The one you get will be regular size.
Yeah. They should make them like that for dogs.
Yeah, you keep saying that. Okay, all right. So we drew on my shoulder. Brad, do you want to come on this side?
Oh, yes.
And Brad's going to help point out because I can't see.
You can get underneath them. Oops, I found your mic piece here. There we go. It's all right. Yeah, this is a beautiful drawing here.
Yeah, it really is. Okay, let's start off, Brad. You know, usually the first thing that I look for is the clavicle or the collarbone.
Sure.
Because it's easy to find, and it kind of leads you to the other ones.
So this is outlined in blue right here. And it's pretty easy. Anyone can feel the clavicle bone. It gets kind of tough when you get up in here when it transfers back into the acromion.
Right.
And that's a joint.
So that's
joint.
AC joint. It's awful painful in weightlifters. So I will push on the joint to see if they're having, and I think Brad's wife has the trouble, right?
Yeah, she has hers separated.
Right.
I separated mine. It's a common one to separate. If you don't break your clavicle when you fall, you have to separate that one.
This bone actually pops up a bit.
Yes.
So you can also push it along here. I found it broken on some people.
Yep. Bites a little bit. So I'm pushing, and usually I'll push a little bit harder in here, and we get over in here, and right there I can feel the AC acromioclavicular joint.
Now right around here, am I pointing right? The humeral head.
Get your hand out of there, Bob.
So
Bob drew this humeral head. I think it's a little bigger than it actually is, but Bob says no. But yeah, anyways, the humeral head is right underneath all this muscle. There's large deltoids Bob has.
So it hooks up with the glenoid fossa, but
that's deep. Yeah, that's deep underneath in there.
But it's part of the upper arm, basically.
Right. It's that ball and socket joint of the shoulder.
The most important area, Brad, I think, is the area underneath the acromion.
Yeah. Can you turn sideways a little bit?
Sure.
Now, this blue area right here, that's if you push on it, it's skin and then there's bone. And that's the acromion, which is the end of the scapula or the shoulder blade. And that's important because that's part of the joint. And the let's pull this up.
Yeah, if you could show the
supraspinatus muscle is here. There we go. The supraspinatus in black here, dark brown. You can see it goes underneath the tendon. Here's the tendon. Here's the muscle belly. The tendon goes underneath this acromion bone. Then it comes out again and connects to that humeral head. But that is probably the most commonly injured rotator cuff muscle there is.
Because it gets pinched under the acromion.
The impingement syndrome.
So if it doesn't pinch under the acromion, there's other things that can get pinched under there. The bursita.
Yep, the bursa
can get pinched. You can also, can you show the coracoid acromion ligament?
Sure. So there's a bone right here, this little blue one here, and that's a little bit deeper. And that bone stops here, but there's this kind of a purplish color thing. That's a ligament that connects the coracoid to the acromion. And that
can also pinch stuff.
Yep. Actually, when they do a surgery on that, they'll actually cut that and get it right out of there because they say it's not even really necessary.
I didn't know that.
Yeah, I just learned that on my continuing ed surgery class.
So when we're pushing, you're pushing around, you want to see if it's tender under the acromion or under the ligament.
Yep.
And that means something's being pinched. Very common. It's like 60 to 80% of the shoulder problems are from that.
And typically when you go up like this is when that impingement happens on that tendon or the bursa.
So we will show you 2 exercises to help you if your stuff is getting pinched in there. Well, it's the bursa, your tendon.
Yes.
If it's getting pinched in there, we're going to show you what to try.
Right.
Just so the bone gets pushed back in place and doesn't pinch.
What about these other anatomical structures?
These muscles often get stretched out if you have poor posture. And
so there's a bone right here, right underneath that is the infraspinatus. This is the supra above the spine of the scapula. The infraspinatus below that muscle also is part of the it's one of the rotator cuff muscles that connects to the humeral head.
All 3 of these muscles are.
And then this orange one right here, that's another part of the rotator cuff. It is the teres minor. It makes your arm externally rotate. Smaller muscle. And then let's look at your bicep before we carry on to the exercises. Look at this massive bicep. The lines here represent muscle fibers. That was my idea. And then they go up to the tendon, and there's 2 tendons to the bicep. That's why it's a bicep, 2 muscles, 2 tendons up here. But we're only going to show one because that one is the most commonly
That's
injured.
the one that gets pinched.
Yep, it goes up into here and actually connects up to the labrum, which is part of the fossa, the ball and socket. And actually, I have a problem with that right now. I might get mine injected next week.
Right.
I'm not sure yet. So anyways.
You're very familiar with it. So I'm sure that was clear as mud.
Yeah.
But either way, if you push, under the acromion.
Just right in here.
So if you follow the clavicle and right at the end, and then push down a little bit, go down a little bit.
I'm going to go right over it, right there.
Sure.
That's where I usually, and there's a tender spot if you have that tendonitis, because that's oftentimes where it gets pinched, and that's where it connects to that humerus.
Then you're going to try one of these exercises.
Yeah.
So the first one, if you got a broomstick or a booyah stick, what you're going to do, Brad and I kind of discovered this by accident, and we found out it seems to work.
We're doing not the Statue of Liberty. Okay, good. Well, it started from Mackenzie's stretch for the shoulder.
And we just added a little twist to it.
Exactly. So, Bob really discovered this.
So Brad called it chicken wing because that's a wrestling move, right?
That's what it reminded me of in high school about 10 years ago.
So I'm trying to. We're actually now this what you wouldn't do if you have a shoulder replacement,
right?
And you wouldn't do if you have osteoporosis, and you shouldn't do it if you have loose ligaments,
hypermobile, double jointed.
So I'm going to probably just go up, move the stick up the shoulder like this.
So this arm is just doing the work. This one is getting the stretch, and you're not going to do this if it creates sharp pain.
Right.
Should be
this should
stretch.
feel better.
Just a stretch.
And then this palm is out, this palm is in, and then I'm going to go ahead and leverage it, but I'm not hitting my head. So you leverage it forward, and that's going to stretch it out like this.
Over here, And again, you're not going to do these if they create pain. If it does, you can just bump into the pain a little bit and then go back down. And day after day, you should stretch it a little bit more. If it gets worse the next day, it means it's not the right stretch or it's too early.
I've had, success with this. I mean, it helped myself. It helped my wife. It helped you for a while.
Yeah, but mine's a complicated story as usual.
Yeah, really.
But if you have problems reaching behind your back to maybe get your wallet out or tuck your shirt in.
If this side goes way up and this side only goes up to mid back, you could probably do the stretch and you're going to find out it helps in the end.
Yep. And you probably have a little pain with the tight shoulder. As a common
exactly.
thing.
It's your combination. So you want to show the strengthening of the external rotators?
Yes. Let's grab a band here. And we were considering. Oh, here we go. So you need a 2-band. You can use any kind of stretch band that you want. You need to anchor it. We use the wall anchor. It works very well. And then I'll show you. Let's do this. There we go.
I was going to say, yeah.
So I'm going to go this way. This is a very common rotator cuff strengthening exercise. Elbow stays close to the ribs. If we go out like that, well, you want to grab that towel. We'll show you a little trick that we use all the time with patients, so we assure you get the mechanics proper. So you do 10 of these. If it creates pain, ouch, then you don't do it. Oh, there we go. You can just take any towel, roll it up, put it there. And if that towel, I'm doing this is correct. If I go down like this, it's no good. If I go out like
He's
this.
maintaining that right angle.
Yep.
The entire time.
If the towel falls down like it did, that means my elbow was too far away. Typically, I'll have a patient do this, and when they come in the next visit, they'd understand the mechanics, and you don't have to put the towel in there every time, because once you're good, you're good.
If it keeps dropping, you put some soap in here, and you beat him like this.
Why, Bob? Why? He's digressing into childhood again.
Yeah.
That's what happens when you get over 60. Do we go to the next one?
No, that's it.
Oh, I thought we were going to show. Oh, that's.
I showed the.
Actually,
tickling.
if you want more rotator
That's what
cuff,
happened when you get over 60, but it's not over 60 yet. But
yeah, but I'm a little early.
yeah.
If you do want to get exercises and complete program for your shoulder pain, we have programs on it, don't it, on our website?
Yes.
Yes.
Yes, we do.
Go to Bob and Brad website. You'll see a programs tab. Click on that, and you're going to see a program for
Shoulders.
Shoulders are going to be about
Yep.
15 to 20 separate videos, and they have a PDF printout. So you click on that, and it gives you
What's it cost, Brad?
$0.
Zero.
You get a PDF printout.
It's our
of all
gift.
the exercises.
Let me tell you, I'll tell you, you would pay a lot of money for these. I mean, there are people out there charging for these programs,
Right.
and they're charging several $100s.
I think, do they call them programs? That's
Well,
ours.
I don't know.
Yeah, we got to get that word out. People need to
That's
know
right.
programs. Is it still on, or am I popping it? Maybe I got
All right.
low batteries. Yeah, well, goodbye. We don't have to
All
talk
right.
about this in the air. Yeah.